good morning and good evening, wherever you are. My name is Action Amos, and I'm the Vice President of the International Bureau for Epilepsy Africa, and I'll be your moderator for the first session, and later on, a colleague from Cameroon, Comfort Musa, will be taking the last two sessions of our discussion. And once again, welcome to this webinar, where we looking on how we can make epilepsy a health priority, and also putting epilepsy on the health agenda. In the previous webinar that we had previously in September, we looked at the situation of epilepsy in Africa, and we had people from WHO, people from African Disability Alliance, and some of our chapters as International Bureau of Epilepsy, highlighting some of the issues that are affecting us today as persons with epilepsy. But today we have a very interesting topic that will be covering, and will be covered by different speakers from different backgrounds. So we'll be focusing on the WHA World Health Assembly, which is World Health Organization Resolution 6820. Which is epilepsy, and neurological disorders and their synergies. What we want to hear today is why do we need this global plan? We have our youths who will be participating in this webinar. So we have taken from South, Central, Eastern Africa, and West Africa, and they'll be giving us perspectives why they feel that this resolution that was passed by, that was endorsed by WHO is quite important, that it should be further endorsed with the amendments that have been put in place. So we'll get to know more about this, and our youths will be answering different questions. And also one key question that will be answered is, why is it African governments turning a blind eye to epilepsy? So we'll hear from the experts that we have the need of having this global plan. As we know, the global plan will not work at global level, but will have to be domesticated. Will have to be domesticated into national plans and also development of national plans. Just think of it, if each of the African countries was to have a national plan on epilepsy or a national coordinating mechanism, that would make a big change. But some would say, well, probably a lot of health plans are not being implemented. But there is a big difference. We are talking of a constituents of not less than 10 million people in Africa that need those plans. So there is need for us to have the national plans and also to have the national coordinating mechanisms in place. And that's the discussion of today. However, we have a very interesting first part, which is a call from Her Excellency Dr. Joyce Banda, the former president of Malawi. She was supposed to be part of this discussion, but because of an emergency in South Africa, she left Malawi on Sunday, going to South Africa to attend an emergency. However, she left us with something. So let's watch and listen what she had to say, and we'll talk about her more after watching this. Sorry, there's a request if we can mute our microphones, and then we'll let Anne share the video with us. Okay, and if you can share us the Dr. Joyce Banda recording. Okay, N, or maybe Mbufo, if you're able to share the recording.
Can you come again, please?
Okay, we seem to be not able to get the recording, but N will try to sort that out, and it will be shared. It will be shared soon. Oh. Okay, Buto, yeah, I think you can share. If you can go ahead and share. Thank you. Okay, whilst they're trying to sort themselves, maybe we move on with the program. And now let me invite you all to the next session, where we now be discussing the WHA resolution. And the first to go on the floor and give us the presentation is Federick Beuchi. Federick Beuchi is from Kenya. He's an activist and has got a sister with epilepsy. And Beuchi is currently running with the banner Epilepsy Lives Matter, and is currently embarked on an adventure of climbing Mount Kilimanjaro for the sake of epilepsy. And the title of his discussion is Putting the WHA Resolution 6820 on Mount Kilimanjaro. Let me invite Federick Beuchi.
Thank you so much, Amos. I don't know if you can confirm if you can hear me clearly.
Yes, sure, we can hear you, but on the low side, but you can continue.
Okay, I will try and be a little bit louder. I don't know if that's okay now. I was requesting. Okay, I was requesting if maybe I could have been made a presenter. I could share my screen. I only have 3 slides. I understand. I think maybe Anne is the one that can make me a presenter, so that I can just display my screen, only 3 slides, and then I'll proceed. Amos, I can see you are talking, but I'm not. Okay, thank you so much. Thank you. Amos, please unmute yourself. I just need to know if you can hear me and you can see my screen now.
Sure, we can hear you and we can see it on the screen as well.
Thank you so much. So my name is Federick Beuchi. I'm from Kenya, and as Amos had mentioned, I'm an epilepsy activist, and I am the National Secretary, the National Epilepsy Coordination Committee here in Kenya. I'm glad to have this opportunity to speak on putting WHA Resolution 6820 on Mount Kilimanjaro. So I will proceed on the next slide, just an introduction. The WHA 6820 Resolution, Chapter 5 on social response says that funding needs to be directed towards epilepsy awareness and stigma reduction programs, as knowledge is an important factor in reducing the degree of discrimination and negative attitudes towards people with epilepsy. This includes education of traditional and faith healers and the wider community. So from that extract on social response for the WHA 6820 resolution is where now I want to bring in the aspect of what are the opportunities that we have creatively to use in being able to create awareness about epilepsy. In 2018, I had an opportunity to do an expedition of walking from Nairobi to Mombasa. I covered 482 kilometers in 12 days. So the whole idea of a person walking for 482 kilometers, it is what really attracted the media to want to know for what reason. And the reason behind this was to create a buzz around media wanting to cover this person who is walking, that presenting an opportunity to talk about epilepsy. So the challenge was aimed at raising awareness for epilepsy in Kenya and to mobilize funds to support children with epilepsy to access medication. And as a result, over 2 million people were reached with information and 100 children supported with access to anti-epileptic medication. So this year, we want to take it a notch higher to create awareness across Africa. And there is something we say here in Africa, that there cannot be a better place to seek for endorsement of such like an activity than on top of Mount Kilimanjaro. And you know, in the past in Africa, if you wanted to really give out an important message or send a special message, you'll either climb on a tree or go on top of the mountain for people to hear your message. And I think this is one of the methods that we want to use to create awareness, by getting ourselves on top of the mountain so that we have an opportunity to shout epilepsy as much as we can. So this expedition will have two activities. First is cycling for 6 days. The route is Nairobi to Namanga border to Arusha, Tanzania, all the way to Moshi. And then rest for 2-3 days and then start climbing Mount Kilimanjaro for another 7 days. And the objectives of this expedition, number one, is to rally local and regional and international media in supporting epilepsy awareness in Africa. Number 2 is to fundraise for translation of epilepsy awareness materials into our own African local languages. And number 3 is to synergize the epilepsy care stakeholders in developing user-friendly awareness messages for Africa. And number 4 is to advocate for the rights of persons living with epilepsy and to finally support children living with epilepsy across Africa access medication. So these are the 5 key pillars of our objectives, even as we look forward to see how best can the WHA 6820 resolution on that is advocating for more resources to be availed so that knowledge about awareness, knowledge about epilepsy can reach out to so many people, actually can be actualized. So those are the key objectives that we look forward to achieve in this. The expedition dates and activities are as outlined here. On 16th November, we'll have our major media briefings, and we have already gotten some endorsement from the international media, from BBC to the regional medias, and we will be having this on 16th November in Nairobi, and then we will begin our cycling on the 17th all the way to 22nd of November. And then I had mentioned earlier, the route that we will take is Nairobi, Namanga, Arusha, all the way to Moshi. We are a team of 6 people so far. We hope that maybe a good number of other people might want to join. From other countries, we had extended an invite, but as we all know, we still have the challenge of, COVID and the clearance that we need to seek on the borders. So that will kind of like be a little bit of a challenge, but we are trying to see how best we can work it out. The second activity will begin on 25th of November all the way to 1st of December, and this will be climbing Mount Kilimanjaro. I happen to have had an opportunity to visit Tanzania last week to make arrangements, and the team there is really waiting for us, and we are also working with the chapter across in Tanzania to see how best they can also be part of this, because the idea is to rally every African country that has a program about epilepsy to be part of this journey. So finally, in 2018, as I had mentioned, we really had an opportunity to utilize the media, and it was very impactful. We have these links from newspapers to the TV interviews to radio interviews that we were able to get opportunities on, and we were able to actually reach out to people with information. So basically, that's a picture of what we are really looking forward to, engage every stakeholder, every country around Africa to be part of this expedition. We are climbing Mount Kilimanjaro on behalf of over 10 million people that need the global epilepsy plans and the national the global epilepsy plans and the national plan to be seen that is in effect, and reaching out to over 10 million people is really not a joke. We are talking of, if we are to draw comparison, that's the whole of Hungary or the whole of Sweden, or the whole of Jordan. So it's a lot of people that we really want to see how best we can reach out to them, and everybody to have the basic knowledge in their own languages and see how much impact that will be. So finally, I just want to thank you, Amos, for this opportunity that you presented for me to just highlight on the importance of the WHA 6820 resolution and how it can be aligned with the Kilimanjaro expedition. And I want to welcome everyone to support in the best way that they can. For more information, you can check on YouTube. We have a channel that we have been putting all the preparation journey into videos and into interviews. I will share the link on the chat box so that you can check it out on YouTube. Thank you so much.
Thank you a lot, Fred, for that highlight. And if we followed well, the main aim of this adventure has been highlighted. One is to create awareness on epilepsy. Secondly, just as in Africa, when we're making announcements and we're in the village, we have to go, either we climb in a tree or we make an announcement. Back then, we go in a mountain and make an announcement. So this is a serious announcement that's going to be made. We're waiting for that time when we are going to see epilepsy at the highest peak. There's no highest peak other than being at Mount Kilimanjaro, to send our message that this is the right time for us to have the global plan and then later domesticated into national plans that will assist persons with epilepsy. We thank you a lot, Fred, for that presentation, and looking to be joining you on that adventure and many more others to be adventure. Now we move on to the next speaker. And our next speaker is a Golden Light Award winner with the International Bureau of Epilepsy, a young lady who has done quite a lot around issues of advocacy, lobbying, and creation of awareness on epilepsy. And she's from Uganda, and currently she is running a project on promising strategy funded by Bench Foundation. And on the onset, I also highlighted that we have two projects in Africa that we're currently implementing. One is the promising strategies, and the second one is called making epilepsy a health priority in Africa. And both these projects have been funded by Bench Foundation, and we want to thank. And one of such projects is being done in Uganda. And let me invite Nina Mago, who is going to present subject Golden Light towards Resolution 6820. So Nina, it's your time.
Hello, everybody. I hope you can all hear me clearly.
Sure, we can.
Thank you for making the time to be here, and a very good afternoon to you all. As young people living with epilepsy, we have a vision. An inclusive world where people living with epilepsy can lead meaningful, dignified, and highly impactful lives while enjoying our basic human rights. When we say that we are the leaders of tomorrow, we are the leaders of tomorrow. And when they say that we are the leaders of today, we are an integral part of that leadership. We cannot afford to leave anyone behind. People living with epilepsy face many challenges. While some of these challenges may vary due to age, gender, location, economic status, etc., I would like to share the stories of girls and young women in communities that I am attached to, with focus on Uganda. Susan, 16, was abandoned at the tender age of 3 after both her parents came to an agreement that Susan's seizures were a clear sign that their decision to be together was a grave mistake. As the eldest in the homestead, Susan upholds the socially constructed gender roles that are still so strong in many of our communities. She cooks, cleans, fetches water, and cares for the animals, in addition to caring for her elderly grandparents and younger cousins. Susan's uncontrolled seizures resulted in her sustaining burns after she fell into an open fire as she cooked. Her closest health center is 1 hour and 20 minutes away, and she has been sent back several times with no medication or a change of anti-epileptic medications to change again when they restock the center. Kate, Kate's mother, a nurse, has journeyed through life single-handedly caring for her children. Her fear of a burden so big, becoming even bigger, has led her to secretly administer contraceptive pills in the guise of vitamins that are to be taken with Kate's anti-epileptic drugs. She cannot stand the thought of Kate having a child with epilepsy. Kate is 32 years old. Makula left the village to find work in the city. She had started having seizures, but could not afford the medication. She got a job as a housemaid. She was very hardworking and a loyal employee. The day, though, that Makula got a seizure with her boss around, she was asked to leave due to the fear of contagion and the bad luck associated with epilepsy. She begged to stay, but the lady of the house ended up calling the police to take Makula away. Ben's 11-year-old daughter, Samali, is a vibrant little girl who enjoys school, and most importantly, she enjoys art class. Even with the seizures, Samali often comes home with a good report. Ben was called one day and told to take Samali home that she was unwell. Later on, Ben was asked not to bring Samali back to school because, I quote, Samali brings down the standard of the school, end quote. Ben willingly took his daughter away because he felt like the school had done him a favor in the very first place. The lack of access to medicine, coupled with universal stigma and discrimination associated with epilepsy, is resulting in otherwise avoidable mortality, disability, social exclusion, and increased negative mental health outcomes. Given the above mentioned, action on epilepsy ought to be a priority, and it will take concerted multi-sectoral efforts in form of a global action plan to address the needs of people living with epilepsy. A global action plan will ensure dialogue on a national and regional level. We call on all our governments to adopt the WHA Resolution 68.20. It will also give us, advocates of people living with epilepsy, a way to more effectively work with our governments to close the treatment gap and inclusion gap for Makula, Susan, Kate, and Samali, as well as improve prevention and expand research. Thank you very much.
Thank you, Nina, for your presentation. And we see the importance of wanting or needing to have the national plans and also the mechanisms when we hear stories such as these ones, where young girls and women need special attention. It's very, very important that this global plan has to be indoors. So we thank you, Nina. And to all the audience, we'll have a discussion of these two presentations. But for now, let's just watch the call that was made by Dr. Joyce Banda. We had a technical hiccup, but now we will be able to show it. Okay, N or Mbuto, either of you is able to show it now? Okay, no, thank you so much. Let's proceed with the program. As soon as they're able to share it, then, okay, it's been shared now. Sorry, and we seem not to have a voice.
One of the leading causes of disability, and the second. Dear friends, my life experience as a mother, grandmother, and of working as a community and social worker, as a national leader, as an advocate, as a philanthropist, and as a president in Africa, I have seen people with epilepsy suffer, and my heart bleeds to see this continue. I've come to know that epilepsy is one of the leading causes of disability and the second leading cause of death worldwide, and that it affects over 10 million people in Africa alone. I have come to know that the risk of premature death in people with epilepsy is 3 times higher than in the general population. I have come to know that epilepsy is a treatable condition and can be treated at a very low cost. I've also come to know that financing epilepsy and other neurological conditions is limited. The current treatment gap is over 75% in most low-income countries. There's lack of access to medicines, and there's a high discrimination and stigma associated with epilepsy from village all the way to the global level. If you and me are to leave no one behind, as per our Sustainable Development Goals, especially number 3, of ensuring healthy lives and promote well-being of all at all ages, we need to consider epilepsy to be on the health agenda in Africa and beyond. There's need for effective intersectoral partnerships and action plans that involve all stakeholders, including people living with epilepsy and other neurological disorders and their families. I therefore want to urge all governments in Africa and worldwide to, 1, provide the necessary support to World Health Organization and partners to develop the intersectoral global action plan on epilepsy and its synergies with other neurological disorders. And secondly, to develop a national epilepsy plan and national coordination mechanisms in all countries. I want also to request all development partners to provide necessary support to World Health Organization and partners to develop the intersectoral global action plan on epilepsy and its synergies with other neurological disorders. And secondly, to support in-country efforts to develop national epilepsy plans and national coordination mechanisms. Please join me and others to change the lives of persons with epilepsy and other neurological conditions. If this does not happen, persons with epilepsy and other neurological conditions will continue to suffer and be marginalized. I thank you for your attention.
Okay, that was a special call from the Excellency Dr. Joyce Banda, the former president of Malawi. And it's unfortunate that she was not able to be with us today, but she will continue working with us as we continue to lobby and advocate to ensure that epilepsy is put on the agenda. Well, having come up to this far and having listened to the presentation, we have missed one presentation which was supposed to be presented by Commissioner Dr. Wawa, who is the commissioner with the Zambian Human Rights Commission. However, as we were starting the program, he sent an apology to say he has been involved in an accident. He's a person who is blind or visually impaired, so he had not gotten all the facts of what has happened to him. So we just wish him well as he's attending to the extent that has happened, but he was able to send us a message, meaning that he seemed to be okay. In our future webinars, we will be able to invite him again and be part of these webinars. Well, maybe for now we can open the floor if from the presentations that have been made so far and the call. If there are any questions, we ask you to put them in writing or maybe by indication of the digital hand so that we can take some of your questions and also those that have presented, Fred from Kenya as well as Nina from Uganda. Okay, I can see a hand from Buso, Chantel. Okay, let's start with Mr. Mbuso.
Thank you, everyone. Afternoon. I'm highly delighted to hear a powerful message from ex-president of Malawi, Dr. Joyce Banda. It shows that the IBE-Africa is trying to take a good lead, because we know that it's been long time, some years back, trying to strive to meet maybe our goals. Unfortunately, the epilepsy is hidden. There's no one who's trying to take this initiative to support our objectives and our goals. As we know that everyone is looking forward to another challenges, as we know that there is some HIV, malaria, TB, and even worse, from better to worse. Now every countries are focusing on COVID-19, which means it shows that if you are not pushing very hard to advocate vivid about epilepsy to be a priority in Africa, maybe we can try to make it. But I'm very, very happy. Some powerful message from the Dr. Joyce Banda. As we know that our WHA 6820, there is a space whereby they are talking about the head of states is their responsibility to push this agenda for epilepsy, which means if we can try maybe to invite some maybe powerful people to make everybody to make this our agenda to be a priority. And even at the same time, Mr. Amos, Vice President, please, if you can try to invite some people from in the big companies just to listen what are our problems in this issue of epilepsy, more especially even the children and even the women, because you know that the big challenge is with is for the woman, which means I think it can help us to change their policies in their companies, to do themselves the awareness about epilepsy, and even helping us as a chapters in our different countries in Africa to put this fully support, because we know that we are struggling, we're in the desert, is no one who's trying to maybe to take our maybe our problems to support us. Thank you.
Okay. No, we thank you a lot, Mr. Buso, and coming from a person with epilepsy, so it really carries a weight that we really need the support, and we need to ensure that we come out in the open. And maybe let's, because of time, let's just take one more comment from Marina, then we move on to the next session. Marina.
Thank you very much, Chair. Firstly, I'd like to thank IBE-Africa for the opportunity to not only hear these messages, but also to interact with our sister organizations in Africa. So that is a fantastic opportunity. Thank you very much, and I look forward to more of these webinars. I'd like to congratulate both of the speakers that served with me on several IBE committees, and congratulate them on the message that they've brought to us. And then lastly, I would like to ask if the message from former President Banda could be shared so that we could use it in our own advocacy work. Thank you, Chair.
Okay. No, thank you, Marina. Definitely that will be shared with everyone, and it can be used for advocates. And just to tell everyone here that—
I have a small question, just a small one. Yeah.
Okay.
It's about
Please
to see.
Go ahead, Chantal.
Yeah, because I saw the work for Federick Beuchi, because we try to make the national coordination and national plan working together. This is a great example for Kenya. And I'm trying to ask Nina Mago also to do at least an activism advocacy to pull on youth who she used to help in Uganda to claim the Kilimanjaro with Federick Beuchi. Because I think if we put on the top of the hill a flag explaining the resolution W68, and that will go to the BBC example, and as a Voice of Africa, this will send the message clear enough to all countries. And I think the way they need to work, they need to partner. It's about synergize Uganda, Kenya, Malawi, other youth who can even having money to go. I prefer even them to create a group and then to reflect to other youth. Then in the camping, they can explain to others how they started their own surgery of advocacy. Thank you so much.
No, thank you for that comment. I think Fred, Nina, you have heard those suggestions coming from Chantal on how we can improve on the visibility. Now we move on to the next section, which is a panel discussion, and it's going to be handled by Comfort Musa from Cameroon. Comfort Musa is an award-winning journalist with IBE in 2014. She won an award for Journalist of the Year. She has also won other accolades with the Commonwealth, which were conferred by the Queen herself for best journalism work in Africa. And currently she's also part of the IBE-Africa Communications Committee, and we've been working together with her. So over to you, Comfort.
Okay, I just want to test my sound.
No, we can hear you.
Does it sound good? All right. Hey, everybody. Good afternoon from Yaoundé, capital city of Cameroon. I'm glad to join all of us from different parts of the world for this webinar. And the panel discussion we're going to have in the next 30 minutes, the focus will be why does the Global Epilepsy Plan matter for youths with epilepsy in Africa? Why is it important? Why does it matter for youth in Africa? And we have dynamic youths from South Africa, Kenya. Well, we have Sharon Mbugwa. Please forgive me if I do not pronounce the name right. Maybe you can teach me the correct pronunciation, but we have Sharon Mbugwa. She's a daughter, a sister, an aunt with epilepsy. She's a marketer and an upcoming executive coach. We also have Gresham Africa. He's a youth with epilepsy, a self-advocate, working as an advocate, an advocacy officer for Epilepsy South Africa for the World Health Assembly Epilepsy Resolution Project in South Africa. We have Nasuna Shakira. She's a youth with epilepsy, a self-advocate, a youth representative on the Epilepsy Support Association of Uganda. And she's also Epilepsy Support Association of Uganda representative on the National Union for Women with Disabilities in Uganda board. And she has a diploma in accounting. And we will be engaging with 3 of them. And as we share with them, if you have a question, you may type it in the chat box, and I'll make sure I read in case we have questions or comments from anyone on the webinar. That way we can manage our time better. So I would like to start with Shakira. Shakira joining us from Uganda. Shakira, I want to find out from you what has been your experience as a youth with epilepsy living on the continent. Hey, Shakira.
Hey, good afternoon.
Yes.
Good afternoon, everyone. Part?
Yes, Shakira. Yes, Shakira, I hear you clearly and I can see you. Which part of Uganda are you joining us from? Kampala?
Right now I'm in Wakuso at
Oh.
the head office, but I came from Luwero, Zirowe sub-county, and I have a diploma in accounting. I'm aged 28 years. I'm a representative, youth representative, Epilepsy Support Association Uganda.
Yeah.
And also I represent Epilepsy on National Union with Women with Disabilities on the board.
Yeah.
I'm having epilepsy since my childhood. I get my medication all my school times, but the medication I was taking, I didn't know that it was all about epilepsy until I reached my college, when my parents told me that I have epilepsy. By that time, I felt so lonely And I was so angry when I heard that I have a chronic disability, but my family was very supportive to me and encouraged me to take my medication. And I kept on getting repeated seizures, and I find that I'm associated myself with wasted matter. My playmates nicknamed me the word Maungo, the Luganda word, meaning someone who does not understand or loses consciousness. This was my name at school, at my community, and it was so humanizing to me. Then the confidence I got through SR trainings enabled me to become assertive, better manage my condition. Due to this confidence, I was able to get a boyfriend or a man who married me in 2017 and married me traditionally and wedded me. I'm now a mother. I have a kid which does not have epilepsy, and I'm a respected person in my community. I'm consulted on a number of issues by my family and community members.
Well, thank you for sharing your experiences with us, Shakira, and congratulations on all your achievements and on the impactful work you're doing. You know, being consulted on a range of issues in your community. I salute your courage and congratulations. And from Uganda, I'll just want us to go down south. Where we'll be talking with Shakira. Shakira, if you can unmute your mic. Hello, Shakira.
Yes.
Hey, how are you today, Shakira?
Sorry?
No, we're talking, Sharon, we want to talk with Shakira, another panelist with South Africa. So Shakira, if you can hear me. Do we have Shakira?
Comfort, I think the representative from South Africa is Gresham.
Yeah.
Oh, Uganda is Shakira. Gresham, Africa, sorry.
Right.
Sorry. Gresham, Africa from South Africa. Sorry for that mix-up. Do we have Gresham? I'm trying to see if Gresham is on and if Gresham's mic is unmuted. Gresham, your mic is muted. Can you unmute your mic, please?
Here we go.
Hey, Gresham, how are you today?
Good afternoon, Hi Comfort. Good afternoon, everybody. Part of the webinar. Thank you so much for this opportunity, and I'm doing great. Thank you.
Where are you joining us from this afternoon?
The best part of South Africa, Cape Town.
Oh, wow. All right. And you listened to Sharon, and how is your experience similar to hers or different? What is your experience, living as a youth on the continent, a youth with epilepsy?
Okay. I'm going to try to be as brief as possible because I see everybody had a very short introduction, so I'm going to try and be as brief as possible. So I am 45 years old, and my experiences as a youth, to be very honest with you, is mostly a blank to me as I'm actually speaking to you now, because I have very few memories of my youth, which should be from primary school, secondary education, work experience, and how I actually felt during these times. I remember my mother told me when I was in high school that one year I handed in a blank exam paper, and that's when she realized that something was not right with me. And then this happened for 3 consecutive years. And then she took me to a neurologist, and the neurologist was able to tell her what was actually wrong, because unfortunately that time my parents were ignorant. They didn't know about epilepsy and the effects of how it would affect me growing up. And they took me out of school because they saw, okay, no, he's not doing anything, he's probably not intelligent enough, and they put me in a technical college, and the same thing happened. And then they took me to the neurologist, and the neurologist checked me out, and he said, this is something that you developed at birth, where it was a head injury, and it's something that developed in primary and high school. And then there was one thing that the doctor told me, the neurologist, he said to me, I will never ever forget it up till this day. It was probably like 30 odd years ago, and he says to me, if you never outgrow this condition, you will possibly never be able to drive a car one day. And that is something that has stuck with me for a long time, where up till today, I'm still not able to drive a car because I'm still having my seizures, I still have epilepsy, I'm on medication and all of those things. Then that is what. But what happened was, when my parents took me out of school, the technical college thing didn't work. They put me in a retail job, because having epilepsy, it's not easy finding a job. And my parents put me in a job where I started off as an assistant, and after about 10-20 years, I worked my way all the way up, where I was in the photography industry, started as an assistant, ended off as the manager in one of the stores. And then towards the end of my work career, I ended up not working there anymore because my epilepsy affected my work, where there was forgetfulness, and something would happen to me, and those are the things that obviously would affect me at work, and that is the reason why I wasn't able to. And obviously memory loss and things like that was also a big thing for me as well with work. So then I was unemployed, and finding a job was difficult, as many of us with epilepsy will know. And the other alternative for me was to be self-employed, and that is where I took my photography my experience of all the years, and I took that and I became self-employed, and I became a professional photographer. And that is something I did up till today. That is something that I'm still doing. And what has happened is that I got married, and not knowing that all these years I was insecure because of all these challenges that I was going through, and I just wanted to be a normal person. So when I got married, I had responsibilities, I had a wife, I had a family, and all of those things. And then I tried to be a normal person, if that is the right word that I can use, because everybody, I looked at them and said, nobody can understand what I'm going through. And then what happened was, things became so bad for me, and I thought everybody else is different to me, where I did something very irresponsible. And in hindsight, when I look back now, I took myself off my medication because my medication had negative side effects like losing weight, not remembering things, forgetting all of those things. And I thought I was being clever by saying, you know what, I'm not going to take this medication because it's not working for me. Because now and then I would have a seizure, it would stay away, it would come back. And I did a very irresponsible thing, and I took myself off my medication for 8 years. 8 years I didn't take my medication. But today, I will never ever advocate to anybody to ever try that, because it has deteriorated my behavior. It had devastating effects on my relationship with my wife and my children and everybody else that I got into contact with. And I was even told by people, you have a demonic spirit living inside of you. And hearing all these things, I became reclusive. My wife used to tell me, you just sat in the room, you didn't talk to anybody, you were angry. And I'm thinking, what is wrong with all these people around me? Why are they treating me this way? But it was because I stopped taking my medication, and it affected me. And that is why I will tell people, never ever stop taking your medication. The medication is there for a reason, and it's there to help us. Yes, it has side effects, but it's something that you need to take all the time. And my wife and my family, they have been very supportive with me in this whole process. And we should never ever allow the perceptions of people to influence our ability to lead a normal, productive life. And that's why I tried to take things in my own hands by stop taking the medication, but it didn't work for me because, like I said, the medication is there for a reason, even although we are not happy with the side effects of that. So I just want to tell everybody out there that epilepsy can be beaten. You can overcome this. You can move from it, and it doesn't have to stop you from leading a normal life. And today, what I want to say is that I believe all my past experiences, whether they were positive, negative, have made me a living testimony to those who feel that they cannot go on because of epilepsy. And I have the honor and the privilege to do advocacy for Epilepsy South Africa and to share my experiences with everybody to let them know you can overcome this one day at a time.
Wow. Thank you very much, Grisham, for sharing your story with us. You raised so many powerful points. I hope we're having a recording, but I think your counsel and your experience is powerful. It can definitely inspire and encourage other youths living in other parts of the continent. Thank you again. And just listening to your story and your experience, as well as the experience of Sharon, I would say is similar to the experiences of youths that I have worked with in Cameroon as a health reporter, covering health issues like epilepsy. There's an issue of massive ignorance, stigmatization, and needs, coupled with health systems that are not very strong. And so I imagine if we had to talk to every youth in every country, we will hear about experiences of ignorance and, health systems that are not very strong. But we don't want to only look at what is not working in the experiences that youth are having. We want to look at what can change and what can be better, for youths living with epilepsy on the continent. And that's why right now I'll be going to Shakira. Finally, I will hear Shakira talk. Shakira is in Uganda, but I want to find out from Shakira, we have a global epilepsy plan that has been adopted. And
no, it's Sharon from Kenya now.
Sharon from Kenya, thank you. I keep wanting to hear from Shakira. I love your name, but we're getting Sharon Mugwa. Sharon, hope I got your name correctly. Sharon Mugwa, she's a daughter, a sister, and aunt with epilepsy. She's a marketer and executive coach. Sharon, I'm keen to hear from you what you think can be done to domesticate this global plan, because other countries, are making good on it. But when you listen to countries on the continent, we get the feeling that, and it's a reality more than just a feeling, that we're very far, away from the implementation of this global plan. So what do you think practically countries should be doing at this point to ensure that the plan is domesticated?
Okay, thank you, Comfort, and good afternoon, everyone on this webinar. I'm glad to be here. So to answer your question, Comfort, yes, I feel as a nation, as a continent, you can't really compare us to efforts that are happening globally, especially in the West. And before I just give suggestions of domestication, I think it's really unfortunate, because I believe we have governments and leaders who have the capacity. In my country, for example, we have so many policies. We have a mental health bill. It's not yet been signed into law because there's still contention around it. We have so many documents, written by very well-educated people. But when you get into implementation, that's the big challenge. We don't have enough funding, for example, which then, brings down general non-communicable diseases, but specifically for epilepsy, that just becomes lower on the list of priorities. And so, you'll focus on kind of more quote unquote prevalent diseases or conditions. So I think some of the examples I could give or suggestions around domestication, one just begins with a whole lot of awareness. And, it's unfortunate hearing from Shakira and Gresham. My experience is slightly different, and I can give a summary at the end of my point. But you know, just having people know, just, you know, just the basic understanding of what it is, you know, to begin with. And so, you know, maximizing our advocacy efforts as a, you know, as a team here, as a, you know, as a country to begin with. I think the other is beyond advocating for awareness is then advocating for funding to help implement a lot of the plans. So we have the plan at the global level, which speaks to you know, to education, to having integrated healthcare, which is important. But now when we come to the nation, then I think, you know, reaching out and trying to partner with other organizations to bring up the agenda of funding, I think is really, really important, because then, in my view, actions follow resources. And if we can put money behind our global campaigns, when they're cascaded down our national campaigns, then I truly believe we'll be able to make efforts in that regard.
I'll stay with you, Sharon, to understand better the context in Kenya. Your health laws, you actually have laws that and programs that take epilepsy issues into consideration, right? But now it's at the level of the implementation, and what I'm hearing is there is not enough funding for these.
Yes, yes. So we have, for instance, you know, like a mental health bill. We've had one in 2015. We had it amended 2 years ago, but it still remains a bill in Parliament because we don't have enough people supporting that to become law. We have many policies, generally on health, then some more specific on mental health. You know, including, you know, what do you call, signages or treaties that have been signed with, say, local UN representatives. So there's been all this, you know, great effort and great policy work, if I can call it that. But when it comes to the ground, you know, it's, yes, funding is a big factor, but, you know, tied in with that, I'm just, and it frustrates me because I'm like, you know, we still have people, even in our capital city, I'm speaking from Nairobi, which is supposed to be like the capital and the more cosmopolitan, you know, quote unquote, people are better educated, but we still have people here who believe you're possessed if you have seizures. So for me, yes, awareness, and then being able to implement a lot of those policies are the big ones for me.
And who should push this awareness? Who should push this awareness nationally? Because I'm hoping that at the end of the day, all 42 participants here, we're living with actions, things we want to work on and push to make sure we're pushing the agenda forward. So who should take the lead in this awareness?
Yeah. And thanks for the question. It's a good one. So I think for me, it begins with self-advocacy. I think when you hear Shakira, when you hear Gresham, and like I said, mine is a slightly different one in terms of how I live with epilepsy, but we are the ones who know our stories best. We are the ones, in fact, I've been in platforms where you're encouraged to share your experience because you're benefiting so many other people. So even if maybe sometimes you're not comfortable or you feel like, you know, it could maybe make some people uncomfortable, it's really, really important to just share your story and share your lived experience. I believe it begins with us. And then that would be extended to now our national bodies. So for instance, in Kenya, I'm a member of, our national body has a very long name, but it's the Kenya Association of the Welfare of People Living with Epilepsy. So we abbreviate it as KAWE. And they're working hard to try and raise awareness. One of the things they're doing is they have model clinics in Nairobi, in 3 areas of Nairobi, and they deliberately put those clinics in the compound where the county Ministry of Health office is. So I think that's really making a statement, because then when you have people coming for treatment, and you have people coming from all over the country actually for treatment, because those centers provide very, very subsidized drugs, I think even that in itself is advocacy. And then just to extend that to the national level. So I think it begins with you and I, and we mustn't tire, telling people and educating people, because then it should just, develop a ripple effect.
Right. Thank you very much, Sharon. And if I may add, I think the media is also a very big segment, sector that can push for the awareness across the continent. And we have Shakira and Gresham. If you think there are other actors that are key in pushing this awareness, we would like to hear from you, because we want to move on with action in Cameroon. I have interviewed a lot of faith-based leaders who are also pushing this awareness, because sometimes they are the authors of the myth that epilepsy is a spiritual problem, or the demonization of it. So just adding to your list of who can push the awareness, I think faith-based groups and healers can also change, this narrative of the demons being behind, seizures and things like that. And I will go back to Shakira now to find out from you, Shakira, what future do you want for youth with epilepsy in Africa, and what future do you want as a youth with epilepsy on the continent?
Thank you very much. At the youth, the future I want that being its representation on epilepsy for regionally and internationally. I want an quarterly regional and international platform to speak on issues affecting youth with epilepsy, so they are documented globally. And then also internationally, Epilepsy Youth Congress, a continent or opportunity during International Epilepsy Congress to have sessions on epilepsy youth deliberations.